Welcome back. If you or a loved one are suffering from chronic sinus issues, it's time to get help in a safe and friendly environment. Dr. Michael Kaplan of Kaplan Sinus Center is joining us now to share how you can start feeling and breathing better again. Doctor, it's great to see you there. I understand you guys are back open, so tell me, how is it? And I'm guessing you're probably slammed because a lot of people are complaining about issues right now.
Derek, you can only imagine how many people have been suffering at home, and they're finally ready to get out and seek help, and that's what we're here for.
And walk us through this, because typically in normal times, traditional times, when you've been here in Studio B, Dr. Kaplan, I know we've chatted with a lot of your patients who have explained their issues. Talk us through what this process works, because you say that you can help people breathe more easily with just 2 appointments.
On the first appointment, certainly, you come in, we discuss what your symptoms are, I examine you. I've got my own CAT scan machine here, which shows me a very high-tech picture of the anatomy of your nose and sinuses, what's blocked, what's open, what you need, what the options are. And at the next visit, if you're a good candidate, I can dilate your sinuses, make more room in your nose to breathe. And then within a week or two, consistently, I'd say 90% of the people easily are breathing better than they have in years.
It's incredible. So you just mentioned, Doctor, a good candidate. What makes a good candidate, or who would be a good candidate for the balloon sinuplasty procedure?
Sure. Someone who's been suffering from chronic congestion, pressure headaches, drainage down the back of the throat, possibly loss of smell mixed in with that, itchy nose, difficulty breathing, all of those things. If you've been treated medically and not getting better, that's what we're here for, Kaplan Sinus Relief.
It's really amazing how hard people's symptoms can hit them, Dr. Kaplan. And I know living here in Houston, we have a lot of different things in our air and our environment that could cause people to experience some of the symptoms we're seeing on the screen right now. When does someone know that it's bad enough that they need to actually...
Derek, it's about quality of life. And I'll tell the people out there listening to this, it's about your quality of life. When you're having difficulty with your symptoms, it's not well controlled with over-the-counter medications, antibiotics, nasal sprays such as Flonase, Nasacort. When you're suffering and you're not getting better, that's when you can come to see me.
And that constant irritation, too. I mean, I know people who use a prescription nasal spray literally every single day just because they are so desperate to have relief. And sometimes if that person is snoring at night, it can be very disruptive to the home environment, right? And their partner in bed.
Those symptoms can cause such severe congestion that not only you're snoring, your partner's not sleeping, your partner leaves the room or forces you to leave the room. But I'm telling you, as I get you to breathe better, many, many, many times as a result of that, your snoring, if it doesn't resolve, it improves tremendously to the point where your partner's thanking you for taking care of it. This procedure can, in a way, be a gift to your partner because it brings you two back together.
Yeah.
And we've been under a lot of stress these last few months. Anything I can do to bring people together is something that I'm willing to do. I'm willing to work with the people, whatever I can do to help do in a way that's easiest on them.
Yeah, and I know I'm chuckling a little bit, but I know you're 100% serious. This can affect someone's relationship. How many couples have you met who they tell you one person is sleeping in the other room just so their partner can get some sleep at night?
Oh yeah, every week I see it every week, and it's magnified by the stress that so many couples have been under these last few months, for sure.
Let's talk about the safety of your office, because I know you guys you're going through this very stringent sanitation process. Some people may have concerns, but I understand you're following all the CDC guidelines to ensure that your patients are totally safe when they come to visit you.
Derek, we've superseded the guidelines. We're not only wearing masks and gloves, oftentimes head covers, wearing gowns. We're cleaning the rooms infinitely better than ever before. We're even bringing in what are called air scrubbers in the room to clean and purify the air using negative pressure to suck out any air particles. N95 masks, eye covers. And we're asking the families to wait in their cars if the waiting room is too congested, making sure that we're adhering to all the social distancing guidelines. It is not just effective in a safe treatment, it's in a safe environment, especially with regards to COVID.
Let's talk about the recovery time. And I know we've had so many of your patients on our show talk about how quickly they've gotten back to work. Some of them have had the procedure, the balloon sinuplasty procedure, on a Friday, back to work on Monday. How common is that for real, doctor, that people can be back to their normal routine so fast?
That's expected. There are many times where I can get a patient back to work the next day. But I promise you that 99% of the patients that I operate on a Friday are back to work on a Monday. There's no packing of the nose. There's no bruising of the face or eyes. It's much easier recovery than it would have been if one had been in the operating room.
That's amazing. Let's talk about insurance, because I understand the balloon sinuplasty procedure is covered by most medical health plans. True?
Sure. It's covered by all major medical insurance plans, Medicare, and certainly all those plans are verified by our office even before the patient comes in. And, you know, all that information is in front of us, and we impart that information immediately to the patient. It's well covered by insurances.
Well, Dr. Michael Kaplan, it's great to see you. Again, I am not surprised that your appointment calendar is filling up. Thank you for helping us to breathe a little easier.
You bet. Be safe.
And to our viewers, if you would like to schedule an appointment to see Dr. Kaplan, you can call 713-766-0204 or visit them online, kaplansinusrelief.com. We'll be right back.